All right, let's jump right in. If you're one of the millions of people dealing with joint pain, you know it's so much more than just a simple ache. It can be incredibly frustrating and, honestly, pretty confusing. Like, who are you even supposed to call? What's the first step? It feels like you're stuck in a maze with no map. But, and this is the good news, there is a way through it.
So does this ring a bell? You've got that ache, that stiffness, or a pain that just will not go away. And you know in your gut you need to see a doctor. But which one? You're kind of stuck at this crossroads, and yeah, it's really frustrating.
Well, listen, you are definitely not alone in feeling that way. And that's exactly what we're here to do. The whole point of this explainer is to be your compass. We're going to cut right through all that confusion and lay out a really clear, straightforward path to getting the help you need.
Okay, so let's start at the very beginning, because before you can even think about who to call, you've got to understand what your body's trying to tell you. These first signals, they're absolutely crucial.
So, first things first, let's make sure we're all on the same page. What even is joint pain? Well, it's basically any discomfort, aches, soreness, in the spots where your bones meet. Your knees, your hips, shoulders, you get the idea. But the real key here, the big question, is why? Is it from an injury? Is it inflammation? Or is it a sign of something else going on? That's the mystery we've got to solve. So, when does a little ache turn into something you really need to call a doctor about? Well, here are the big red flags to look for. If you're seeing any swelling, stiffness, or redness around the joint. If that pain just hangs around for more than 3 days, or, and this is a big one, if you get a fever along with the pain, that's your body screaming for you to get it checked out. Seriously, don't wait on these. And that right there brings us to the main event. The big question that causes so much of the confusion: do you go to a rheumatologist or an orthopedist? The classic rheumi versus ortho dilemma. Let's break it down.
Okay, this is a great way to look at it. Here's the simplest way to think about the difference. A rheumatologist, they're like a medical detective. They're looking for issues that affect your whole system, like autoimmune problems, where your own body is kind of fighting itself. And their tools are usually things like medication, not surgery. Now, an orthopedist, think of them more like a master carpenter for your body. They're the ones who fix physical things, injuries, trauma, general wear and tear. And they're the surgical specialists.
So how do you know if you need to call in the detective? Well, here are the clues. First off, if you've got pain in multiple joints, that's a big one. It suggests something is going on throughout your whole body. Another clue? The pain didn't come from a specific injury. And on top of that, you're feeling tired, maybe you've got a fever or a rash. Those are huge signs pointing right to a rheumatologist. It's classic inflammation that needs a deeper look. All right, now let's flip it. When do you need the carpenter? This path is usually a bit more straightforward. Did your pain start right after an injury, like you fell or twisted something? Does it get way worse when you put weight on it, like on your hip or knee? See, that points to a mechanical, structural issue, and that is an orthopedist's bread and butter. Okay, so you've picked a path, you've made the call. Now what? What happens when you actually get to the doctor's office? Let's pull back the curtain on the whole diagnostic process so you know exactly what to expect. Your journey almost always starts with your main doctor, your GP. Think of them as your starting point, your mission control. They'll do a physical exam, they'll really listen to your story, and then they'll start ordering some initial tests to gather clues. From there, they'll make that all-important referral to the right specialist. It's a whole process, all designed to get to the bottom of what's going on. And when we talk about tests, they aren't just a bunch of random letters on a lab report. Those blood tests, they're looking for specific fingerprints, little markers that scream inflammation, or, hey, the immune system is in overdrive. And the imaging, like X-rays or MRIs, that lets the doctor literally peek inside your joint to see if there's damage to the bone or swelling in the tissues. All of it is about one thing, making sure you get to the right specialist. So why is that so important? Well, this quote from Dr. Alfonso Bello really says it all. He points out that a lot of times patients go to an orthopedic surgeon first when they really should have seen a rheumatologist. Getting to the right specialist from the get-go isn't just about saving time, it's about getting the right care faster and avoiding that frustrating loop of treatments that just don't work. All right, let's get to the good stuff, the part we've all been waiting for. We figured out the problem, we found the right doctor, we've got a diagnosis. Now, let's talk about finding relief and getting better. First thing to know is that treatment is never a one-size-fits-all deal. It's usually a team effort, a combination of three main approaches. You've got the medical stuff your doctor prescribes, you've got surgical options if there's a structural problem, and then you have all the incredibly important things you can do for yourself at home.
So on the medical side, there are some really powerful tools. Take medications called DMRDs. A bit of a mouthful, I know, but these are a game changer because they don't just cover up the pain, they can actually slow down the disease itself. And then there's physiotherapy, which is just so vital for keeping your joints working and making the muscles around them stronger.
And this is the part you can start doing like today. Don't underestimate how powerful these home and lifestyle changes are. They work hand in hand with your medical treatment. We're talking about simple stuff. Managing your weight takes so much pressure off your joints. Hot packs for stiffness, cold packs for swelling. Gentle exercises like swimming, huge. Even adding anti-inflammatory foods like turmeric and ginger to what you eat can make a real difference in how you feel day to day.
So, we've been talking about these two different specialists, right? The rheumatologist and the orthopedist. But what if they weren't on two separate paths? What if they worked together on the same team?
This is exactly what experts are pushing for. Imagine a world where these specialists are working together, maybe even in the same building. You see the orthopedist, but they think, this sounds more like a job for the rheumatologist. They could literally just walk you down the hall. This kind of teamwork means you get diagnosed faster, your treatment plan is more complete, and at the end of the day, you just get better care.
Okay, if you remember just one thing from all of this, let it be this. Getting the right diagnosis as early as you can is everything. Acting fast isn't just about getting rid of the pain sooner. It's about preventing damage that you can't reverse later on. It's about protecting your mobility for the long haul.
And that really leaves us with a big forward-looking question, doesn't it? Is this the future of how we treat joint pain? A world where these specialists are always working side by side? You know, a future where no one has to stand at that confusing crossroads, wondering which doctor to call? It's definitely something to think about.